So we were drawn to dental monitoring by the pandemic. So we weren't allowed to see patients. So it just seemed a no-brainer to have this system where artificial intelligence was giving us photographs of the patients every week, weekly pictures of the patients. But I was very much into starting new concepts and bringing new things to the practice. And you'd been talking about it for some time before the pandemic. So it was just it seemed that the natural time to do it. And it's been absolutely incredible.
It was obviously the pandemic was a technology surge for everyone because they were forced into that. In developing and making things work as well as you could. So that's what took us into it. And once we came on board, it saved. In reality, it saves us a lot of clinical time in the actual practice face to face. But it also saves patients time on getting into the car, driving to us, or bus, or train, or whatever it might be, and allowing their treatment to progress in an efficient way. So
we can see problems sooner, can't we?
See problems sooner.
Much sooner than we would before. We would be seeing a patient every 8 weeks. And on the dental monitoring, we can see if there's a problem within a week or 2 weeks, a week. So, and then we can ask them to come in. And so that changes everything. So, of course, it's just a lot more, things just go faster, don't they?
They are faster. It takes less time.
More seamless, really.
I'm thinking of a patient here now as well. When we first started, and he had to travel to Kazakhstan, quite a long way. We gave him the aligners, programmed what we needed to do. He was away for 9 or 10 months. He was communicating us through the platform, which was obviously very valuable as well. So if something was not quite right, we could explain what to do. When he came back after 10 months, his treatment was almost complete. So had he not had that, then we would not, and this is with aligners actually, it's not with fixed braces, it's with aligners. So had he not had that, we wouldn't have been there basically.
Yeah.
For sure.
We try to explain it in layman's terms, and we also explain that this is just an adjunct to what we're doing, and it's going to help with their treatment, help accelerate their treatment, and we can encounter problems sooner rather than later. Most people seem to be quite receptive, and most people really like the system. Of course, we do have some people that simply don't want dental monitoring. They want to come in. They can't use an iPhone or any kind of smartphone, but it's very few, I would say.
Yeah, very few. Everyone's different. So if that's the case, that's exactly what we do. We see them kind of face to face. But in reality, it's actually our team that do that part of the explanation. And it really is, as you said, it's hand-holding, and it shows them exactly how to get onto the platform, how to use the scanner, the scan box, and it's just going through that. And if they don't quite get it, then they come back in again, or we through the platform go through it again. So it's actually quite easy. Like a lot of things, it sounds far more difficult, or technological than it really is.